My name is Amelia Ordonez. I am a PGY1 here at the FSU College of Medicine at Tallahassee Memorial. I'll wake up around 5-ish, get in by 6, pre-round my patients, look through the charts. Typically I'll have seen them and have most of my notes prepped by 7:30. Sign out, go to morning report at 8. After that, we end up rounding with the attendings. We will table round first, discuss how the patient did overnight, any kind of changes that we want to make, and then we'll go see the patient with the attending.
I'm Ray Shashadi, Associate Program Director. So in 2001, I was one of the founding members of the hospitalist program here. From time to time, I would have medical students rounding with me, and I really liked that. When the internal medicine residency started here in 2012, it seemed like a natural fit, and so I've enjoyed it, and I've been here ever since. We have 2 ward teams, Garnet and Gold, 1 senior resident, 2 interns, and 1 attending. So there's 2 of those teams that split the patients relatively equally. Our ICUs are still open, and you'll be following your patients in and out of the ICU, so you'll get more ICU experience. We tend to take care of most of the problems ourselves, and if we need a procedure, if we need a consult, certainly available. But I think we manage more of the patient than you might see in a bigger academic center.
My name is Ingrid Jones-Ince. I am the clinic director and I'm also the APD for ambulatory care. Our cycle follows many programs, a truly embedded experience in ambulatory care, whereby the residents rotate through the clinic for 1 week out of a 4-week cycle. So it's a 3+1 model. We have different groups ranging from PGY1 to 3 level. The preceptors try to follow closely, especially in the PGY1 year, to kind of really coach.
My name is Stephanie Evans. I'm from Cocoa Beach, Florida, and I'm a PGY1. Clinic is really great because we get a lot of independence. We get to follow patients over the course of the 3 years that we're going to be here. We take care of their primary care needs, do screenings. Staff is phenomenal. They take care of all the nursing needs. They're super friendly and really easy to work with.
The senior residents help to coach the interns along in the clinic. The physician on call oversees the clinic and makes sure urgent tasks are taken care of.
We get to see a wide spectrum of patients, a variety of different conditions, and I feel like we're really getting a good training for when we go out in the real world.
What we offer here is different. Telemedicine took off in our program and it's going on in its 2nd year here, primarily targeting the senior residents in their 2nd and 3rd year, where TMH collaborated with the Kearney Center and the Transition Center. The residents feel that they're truly participating in continuity of care. Lots of success stories to share.
Hi, I'm Jenny Neckel. I'm one of the co-chief residents here.
And I'm Abram Arnold. I'm a co-chief resident here as well. We have a daily morning report, and that usually entails an interesting case from one of the inpatient services and kind of work through the diagnosis and the treatment. A noon lecture conference series that we typically have a specialist come from just a broad range of specialties, whether it be hematology, oncology, cardiology, pulmonology, you name it. It's a really robust lecture series and to prepare you for both the wards, clinical practice, and for the boards.
So didactics is something that we do in our clinic curriculum. We have the 3+1 schedule. So in your clinic week, you'll be working with the faculty to go over different topics that you're going to be seeing in clinics. Friday, we have a half day of sim lab where we do things like central line insertions CPR, vaginal exams, everything that you really need as far as procedures and simulation for a good, well-rounded internal medicine education.
I'm Vince Riesgo. I'm a third-year resident. We have a dedicated night float team. They take care of the entire IMR floor service at night from 7 p.m. to 7 a.m. A senior resident and an intern are responsible for the ongoing acute care of the patients on the floor, as well as new admissions to the emergency department. We also respond to codes at night, just like the day team would when they're on call. Nights give you the opportunity to practice independently and really get to learn the most out of your admits. One of the great things about having a night float system is that we don't have to call from home. So, once the floor team is gone, the night team is on. So when everybody has their time off, they're truly off.
Hi, my name is Dr. Susan Manson. I'm one of the faculty members here. Our residents do 2 quality improvement projects during the course of their 3-year stay here. You get to choose what you'd like to do, either on the inpatient side or the outpatient side. And some of the projects are so good that we're continuing them from year to year.
My name is Christina Kopian. I'm one of the second-year residents. The other research opportunities that we have available are ones that you can do with the attendings here. There was, research going on with the convalescent plasma, and there's different attendings who are doing research, and you can join along with them. You can also reach out to the research directors at FSU, and they can help.
My name is Dr. Rogers, and I'm one of the faculty members who is excited to welcome you to our doors. Here at our FSU Residency Program, our goal is to make you some of the best and brightest clinicians out there. As you all recognize, we do have a wonderful aging population, so over the next 3 years, you will have access to work with patients on the floors, you'll be working with them in the clinic, and you'll also be able to go out to nursing homes, go out to the hospice agencies, and also make home visits. This is a part of our geriatric restructured program that allows you to figure out geriatric syndromes and to focus on different things like polypharmacy that lead to many hospital admissions.
I'm Kristen Price. I'm a third-year resident. Right now, I've been on the intensive care unit. We have this beautiful new center. It's called the Mushton Center. We spend our time in the cardiac ICU, and we've made great relationships with the intensivists and the nurses there.
My name is Anazilta Edwards. I'm currently in the ICU doing a core rotation. The ICU attendings are fantastic. They take the time out to teach, to let you know what we're doing, why we're doing it. They always ask whether we have questions, and they're always willing, even though they have a hectic schedule, to take the time out to teach us.
We really get to see very, very sick patients and learn how to manage everything you can imagine, from cardiac patients to neuro patients, trauma patients. We get all of those experiences.
ICU is a great time to get your procedures in, and we have a dedicated ICU night elective where you get to work one-on-one with an intensivist doing consults and addressing ICU needs for the 3 ICUs in the Mushton Center.
I enjoy being here and learning medicine because critical care is internal medicine on steroids.
My name is Claudia Krokavodi, and I'm known as Dr. KB. We are a smaller program, and we're intending to stay a smaller program. We have a good diversity in our residency. We're indeed very fun-loving people. We are celebrating quite a bit We are celebrating smaller and larger events. We have parties. We have a wellness committee which is setting up almost every month an event where residents are going out and having fun.
On the interview trail, I like to get the culture and the camaraderie and the feel of a certain hospital and program. We all work together. We do many wellness events outside the hospital.
We're kind of just like a big family, and that was very important for me in my decision to come to this residency. I wanted to see the relationship that the other residents have with each other, because those are the people that you're going to be spending most of your time with while you're working at the hospital or in the clinics in the surrounding area.
We ensure that we want you to be the best when you leave us, and so to do that, we want to hear from you. As a result, we have formulated our program enhancement committee, where our seniors, our interns, our second years play a role in making sure that the residency is improved.
I'm really looking forward for an interview with us and perhaps later on a match made in heaven.